We want to bring in Michelle Gorlow now with Positively Kids, and your organization helps children affected by the opioid crisis, the medical and mental help that's required. Let's start with, what do those emotional wounds look like when you look at a child and you can see that they're manifesting a parent's substance abuse?
Many times the child's going to look defiant, maybe withdrawn, antisocial, and so those can have problems, especially in school when they're trying to learn. They may withdraw and fight with their peers and just not want to be there.
So it is a trauma, just the parental addiction, and if problems that can come out of it. Mom and dad may end up in jail. So there's that to deal with, and then it also sets these children up to be potential addicts themselves.
Absolutely. It does set them up to possibly make bad choices when they get older. But then, as you mentioned, growing up, there's a lot of anger, seeing your parents or another family member getting high, a depression, anxiety, and then also confusion on the whole situation on why this is happening to them.
So much to deal with at such a young, fragile age. And you focus on surviving to thriving. What does that careful process look like?
It's really focusing on the trauma of being affected by the opioids, not just the taking of the opioids and making sure that they're making good choices, but again, looking at the depression and the anxiety, the guilt, the anger towards their family member, and trying to work through those issues.
You bring all of this experience with you as you begin your new role as one of our state assembly members. And congratulations on the win there.
Thank you.
And you just went through your first session, part of the female majority up there.
Yes, thank you.
What did you find out up in Carson City? Is our state doing enough as far as devoting the resources to combat this problem?
I think we did a huge issue. We worked really hard this past session, but we can always do more. And so through the interim committees, we're going to be looking at different ways that we can address the opioid epidemic, whether it's by limiting the drug use and the prescription of it, to helping families and getting the treatment that they need as well.
You're our last guest of this broadcast, so we've seen the feds come in, obviously the doctors, the medical community as well. A survivor here. Are you optimistic about these community partnerships, that we will continue to see progress from the progress that we've already seen over the past few years?
I'm very hopeful and optimistic that we are going to have a lot more progress in it. A lot more partners are coming to the table, and we're seeing more and more people just share their story and tell us how we can help them.
Some of these addictions we see start so young. Do you have any advice for parents of say, a 14, 15, 16-year-old who maybe breaks an arm or something, and the doctor wants to prescribe 30 oxycodones to get through it? What should that parent be watching for? I guess maybe control the pills?
I would definitely control the pills, and then start low. Try a Tylenol instead before going to that Oxycontin or another harder pain medication, and also watch their own medication, because so many times these kids are just rummaging through medicine cabinets and seeing mom and dad take them or another family member, and so they'll grab them as well. So watch your own medications and start small. Go with your Tylenol 800 before you have to go to an Oxycontin.
And hopefully these conversations will get to the younger folks in our community who may, like you said, get into some trouble, or perhaps see one of their friends perhaps get into some trouble. And as we know, with awareness, we hope that that'll turn into good action and prevent some of the awful consequences we've seen of this crisis.
Absolutely.
From what you're seeing at your perspective there, Positively Kids, are you seeing more people coming in? Is the problem getting worse? Are you seeing any kind of stabilization?
Right now we're seeing a lot more children that have been affected and taken away from families because of the Oxycontin across the country. The foster care system is being overloaded because of families not being able to take care of their children, so they're being taken away.
Wow,
and so we're seeing a big increase now of those children that are being affected with outside of just taking the drugs.
Michelle, you are proof that the resources are out there.
Glad you're there to help them.
Great,
Thanks for
thank you
coming
so
in
much
today.
for having me.